You should be following my slides. If you're not, then talk to one of the organizers and we'll fix that for you. Our objectives, I'll take you through. Then I'm going to talk about the world, the global driving forces, what's shaping the COVID pandemic around the world and how's it going to conclude. And when I'm done with that, I'm going to hand over to Rowland, and he is going to talk about Namibia's driving forces and how the pandemic is going to shape up in your country. From that, I get the floor back again, or the screen, and I'm going to show you how we rank these driving forces and why, and how from the rankings we built scenarios, what those scenarios are, and then I'm going to tell you what I think is going to happen. And in conjunction with Rowland, we're going to share that part of the briefing, how this is going to end both for the world and both for Namibia, and then we'll have some questions. Objectives are fivefold. What's the trajectory of the pandemic for the world, the region, and Namibia? I think I've got quite a good sense on the world, and Namibia we'll discuss a bit further. What are the available resources to deal with the pandemic? Now quite well understood. What are the economic ramifications and how will policymakers respond? I don't know if Rowland's going to bullish on the global outlook. You'll see why. Maybe a separate question. How long will this pandemic last, and when is it all going to be over? And then how do you use scenarios in strategic thinking, and specifically these? Let me get underway. Global driving forces. I'm going to show you a number of those, and then the further driving forces of Namibia will follow, as I said, with Rowland. What is number one? The pattern of infection, the question of a vaccine, morbidity and fatality data around the world, the effect of seasons and temperatures, and the fiscal and monetary responses of governments. These are my areas of responsibility this morning. Let's start with patterns of infection. Now, when this thing got going, we didn't know what the pattern was going to be. There was this worst case idea, this exponential infection curve sweeping across countries, 80% of people infected, health systems overwhelmed, and complete disaster. The best case was that there'd be a single peak, health systems would hold up in the face of that peak, and then the whole thing would sort of peter out, and societies would continue with a low viral load thereafter, until a vaccine came along, and that would be the end of the story. And the third option, which we didn't know what was coming, of course, is that there'd be multiple successive peaks and troughs of infection, and that you'd go through these with the commensurate economic shocks and moments of recovery until a vaccine was available. Now, what has happened? Since sort of middle of February, that is the total number of infections in Italy, that is Singapore, that is the UK, that is the United States of America, and that is the position in Namibia. And if you look at these charts, you risk, I think, developing the wrong sense of the pandemic. I'll get to Namibia in a moment. The idea that it's surging and growing and continuing to escalate. But remember, this is the total number of cases. It can't go down again. The figures for Namibia, climbing now. Quite what's going on there, I do not know, but I'm going to suggest a few things as I continue to talk. More useful in terms of the patterns of infection is not to look at the total, but rather to look at the daily new infections that are recorded. So that's the pattern for China, and it goes sharply up and then it goes away, and you say, well, China's kind of a opaque political system. Are we sure on the data? Good point, hold it there. Italy, that's an amazing pattern. Considering this was the centerpiece, you'll have noticed Italy's dropped out of the media on COVID, and that's because the pandemic in Italy is largely under control. Singapore, the same pattern. The UK, the United States, and then Namibia, which we'll get to in a moment. But around the world, countries that can poll, can test and track and so on well and record data, what they show is that on the whole, you reach your peak within 60 days of your 100th case, and thereafter the virus washes out of your society. Now, one view is that that's where it's going to stay, and that's the view that I lean towards. That what's happened in that peak is far more people were exposed than testing revealed. Some had no symptoms, some got a bit ill, a minority got very ill, and some just never got this thing. They just don't get it. And therefore, once your peak has passed, that's the end, and you are in the clear. The alternative view, which I think is going to be wrong, but I'm not so sure enough not to raise it with you, is that there'll be secondary and tertiary peaks, secondary and third and fourth peaks until a vaccine comes along. What do we see in the pattern for Namibia? Well, if you look at the daily number of cases, they're so low, I don't know if we see much at all. But if we do see something, it is that Namibia, having kept the virus so successfully at bay, is now going through its little peak, and then the pandemic will wash out of your country as well. Now, if you want to know what's going on with COVID, the best thing you can do is to calculate R. R is the reproductive value of the pandemic, and it measures on average how many people get infected by each person who gets infected. If R is below 1, it means that the spread of the virus declines, and if R is above 1, then the spread of the virus is going to accelerate. And this little chart, little picture makes it easy to understand. If R is 2, that means that each person who's infected infects 2 other people, and they infect 2, and they infect 2, and so the thing grows very, very quickly. Pause here for a second, and you've noticed as I've been talking, perhaps, that in the bottom left corner of my charts, there are these 2 numbers that jump up. Impact 6, uncertainty 3. What are those? Well, when we build scenarios, we look at these major trends, things like R and infection patterns, and we rank them, on two grounds. The first is, what is their impact going to be on the evolution of the pandemic? And patterns of infection, we initially ranked at 6. We thought it would be the 6th most impactful driver of the pandemic. And a lot of analysts would stop there. They only do impact, and then from there, they'll give you a forecast. We've got experience enough to do something else. We do a second ranking on uncertainty. And there we ask ourselves, how much do we know about this driver? Do we really understand it? Do we have proper information on it? And we ranked uncertainty very highly at the 3rd most uncertain driver of the evolution of the pandemic, with the pattern that the infection would follow. And later on, when I build the scenarios, you'll see how I use those impact drivers in order to create those rankings, to create the scenario matrix. Stay with patterns of infection, and this is the position for South Africa since its lockdown was introduced. And what one sees is that R has very seldom moved below the level of 1. For much of the lockdown, R remained well above 1. There's some problems with the South African data, but not such serious problems that this is misleading. And what it suggests is the lockdown had a very limited effect on the progression of the pandemic through South African society. From R and patterns of infection, we go to the question of a vaccine. Yeah, unlikely available before the end of 2020. But the American political race would certainly be Mr. Trump's position, and I think he knows that, would be greatly strengthened if it was available. So I don't write it off completely, but in 2021, sense is pretty firm, vaccine will start to become available and slowly be rolled out around the world. So that we've got some certainty on. Correlation between BCG vaccination and COVID-19, there was a lot of chatter of that a couple of months ago. We're not sure. There is a trial at Stellenbosch University now. This is a map of countries, whether they vaccinate their people, use the BCG vaccination or not. Red countries don't really do it. Orange ones used to do it, and pink ones do it for all. When you look at that, and you look at levels of COVID infection, I don't know if you see anything at all, particularly when you factor in different levels of testing, different levels of urbanization and integration of people, seasonal factors, and a host of other things, not least of which is living standards. On BCG, we never saw anything to think there's much there. Now, morbidity and fatality is the next mega trend here. And this is the question on the pandemic. How dangerous is this disease to the world? And we've sought to try and figure that out. On the right of my screen, the chart is an example of how not to figure it out. And what we've done there for you is my analyst colleagues gave you the number of confirmed cases up to yesterday for various countries, and then the number of deaths in those countries. And if you divide the deaths into the confirmed cases, you get frightening numbers, 5, 6, in some places more than 10% of people who were tested positive have subsequently died. And it is a frightening thing, but it is a misleading thing as well. Stay with it for this next chart and do the misleading calculation again for the whole world. And what we've done here the chart on the right, demonstrates if you take by country along the far right axis of the slide, and you take the number of deaths and the number of positive cases, you divide them into each other. This is the fatality rate that is produced. And immediately it strikes you that something funny goes on here, because how did the virus get more fatal and then stabilize and in some places get less fatal? Pink is the world, now sitting at a case fatality rate of 5.25%. And the reason is that it's not a very useful measure of anything at all. It simply reflects how deep or shallow your testing capacity as a country is. If you want a sense of what the death rate, frankly, is going to be, a better place to start looking is the seroprevalence studies. Now, these have been done in many places around the world, and what they do is they look for antibodies in a community, they look for the number of deaths in that community, and from now I list for you in the table. One of them is able to produce a death rate of higher than 0.6%. And some of them, like the Miami-Dade study, the LA County study, and also California, the Santa Clara study, have figures way, way down of 0.1, 0.2%. And immediately this contradiction leaps out at you, that if you divide deaths by positive cases, you get 5% for the world. If you do the seroprevalence studies, you're nowhere near that kind of figure. So what is going on here? We think this chart will answer the question for you. It's data we drew from the Centers for Disease Control in the United States. And what the data does, it looks at the number of people who died of flu-related deaths in America over the past decade. Compare the death data that you'll see here with an estimate out of the Americans that about 100 to 240,000 Americans, right at the beginning, was the estimate, would die of COVID-related complications. The figure at the moment sitting at around 120,000, kind of halfway to the maximum. South Africa-wise, flu kills 6 to 11,000 people a year. I don't have any confidence in that number, but we've been sharing it with some clients, but I'll go back to why it's still in this briefing. Extrapolating from the South African and US flu numbers aligns with lower end death estimates for the pandemic. And this is how that works. This is the flu data for America. Decade along, the best flu season of the past decade, 2011, 2012, 12,000 people died of flu-related complications. Worst season, 61,000 people died of flu-related complications. If it turns out now that the American death toll stops at around 150,000, which is where it may stop, that will mean that that the COVID pandemic was 2.5 times more deadly to Americans than the worst flu season of the past decade, and that it was about 12 or 13 times deadlier than the best flu season of the past decade. And between those two extremes, you can draw your own conclusion on the lethality of COVID to the world. But it is not the septicemic plague that kills 100% of its victims. It's not the flu, but it's, arguably only 2 to 3 times more deadly than a severe flu season. And that, of course, raises the question of the efficacy of lockdowns that we'll get to later and the sense in lockdowns. But I said it is more serious than the flu, and we do now see that in global data. The chart to the right takes data from March 2019 and compares it to March 2020, the first two sets of pillars. And the pillars are made up of the United States, Italy, and the UK. And we measure the number of people who died in those jurisdictions in the two Marches. And the number that have died this March is way up. And part of the reason for that is COVID, because we know how many COVID deaths have been reported. But you'll notice that the COVID deaths are only half of the number of extra deaths. And so there's some missing extra deaths. And one thesis on those is that as governments and health systems oriented themselves towards the COVID pandemic, they did not sufficiently treat people who might have been saved, heart attacks, strokes and things. Didn't go to hospitals, couldn't get to hospitals, were deterred from moving out in public. And possibly that's going to be a bycatch of sorts of the firm lockdowns that were introduced in much of the world. From here, seasons and temperatures, and what's the story there? Well, initially, almost all the countries that were showing these crisis curves that were starting to put real pressure on the healthcare systems were quite in their winters. They were quite cold at the time. And one of our concerns, being mainly South African analysts, is that South Africa is now headed into that zone, and by extension, Namibia too. Here's some of the data. January to December of this year, and this is Milan, which was the centerpiece of the initial crisis, and when those terrible scenes were broadcast around the world of the deaths and the overwhelmed hospitals, the temperature in Milan was between 5 and 10 degrees Celsius. Now it's moved into its summer, and as you recall from earlier, Italy's infection curve has completely tailed away, but it will move back into its winter, of course, and the question there is, am I right that there's not going to be a second wave, or will temperatures trigger such a second wave? It's still, I'm fairly confident, but I concede this is a great unknown. Johannesburg, by comparison, slow uptake in the pandemic. Now the numbers are climbing, but the slow uptake was when it was warmer, and now things are getting very much cooler, but we will obviously go back into our summer. New York, the same pattern as Milan, both in terms of temperature and infections, and then, of course, the American fall. I mean, the American spring is upon us in 3 months' time, and then, the American fall moves back into its winter, of course. And Sydney in Australia, similar pattern to Johannesburg. Windhoek, similar pattern to Sydney. Quite what this means for Namibia's infections, and indeed for South Africa's, remains, I think, to be tested. Now, as governments shut down their economies with lockdowns, the consequences were enormous. Unemployment spiked, deficits expanded, etc., etc. And one of the things that governments did to mitigate the consequences is to turn back to stimulus, enthused by the experience they'd had since 2008. The lesson, I think, out of this is going to be that if you cannot do stimulus on an enormous scale, you really have no business trying to introduce an economic lockdown. And the chart to the right demonstrates why. We estimated that on a per capita basis, South Africa and Namibia introduced a roughly equal quantum of stimulus into their economies, about $200. By comparison, the United States and the UK introduced about $8,000 and $6,000 into their economies. And even if our estimates on South Africa are out by a margin of 2 or 3, we're just nowhere in the zone. And I think that recognition has sunk into the South African government, which is why it is getting out of the lockdown business as fast as it can. And that is a very good thing. The broader context of stimulus is, must be to understand the likely long-term consequences one needs to understand a lot of what has, just how spectacularly the economic data for much of the world is reversed. The red numbers on this chart are 2019 budget deficits around the world. The orange numbers are this year. And they've turned entirely around. I know more about South Africa than Namibia, but what's happened here in South Africa should not be loosely compared to what has happened in the United States or many other parts of the world. And the reason is South Africa is setting up this deficit off a decade of extremely weak economic growth with very limited growth prospects. That is not true for much of the balance of global GDP, who will grow out of this deficit position far more quickly, has the potential to do so, than is the case for South Africa. And therefore, some particularly fragile economies might find that once the sort of global economy sort of recovery has been quite sustained for 2 to 3 years, possibly, the fragile economies are still going to be wrestling with the consequences of COVID. And I think South Africa is going to be one of those. Central banks around the world have charged to the rescue on stimulus. The red bars are January 2020. The orange bars are the position earlier this month. Rates cut to the floor, and something we've said to a lot of our clients is don't get COVID tunnel vision. Remember, all the traditional drivers of geostrategic risk are still out there. And if one of those, trade wars, Iran, all manner of things, now washes through the global economy, central banks are largely tapped out. And so a new third party sort of destabilizing thing could very easily tip the world into real trouble without central banks being able to charge the rescue. The same point can be made if a second wave of infections washes across the world. Then what confidence there will be in new stimulus measures given the quantum that's already been introduced. In the same way that the death rates will be very much lower than initial models suggested, and in the same way that I've suggested to you that much of the world has passed its peaks and won't have second peaks, all very optimistic. In the same way, I think we're seeing some real signs of recovery. The copper price is way up from the lows it reached towards the sort of end of March. Gold, well, gold, you know, does all manner of things in crises, not the best one. Platinum's way up. We're seeing the same for, you know, almost every commodity indicator. Crude oil, let's just go back to that one. Remember that a lot of what was happening here was Russia and Saudi Arabia getting cross with each other, but oil's up. Coal's up. The Baltic Dry Index, that measures the cost of shipping bulk goods around the world. It's a great lead indicator. That one's strongly up as well. If I must go out on a limb, which is where we're used to being, my suggestion for you is that the context wherein Namibia is now going to confront the balance of the COVID pandemic is one in which the world's pandemic is starting to tail off. There won't be second peaks. Global economic recovery is going to be stronger than some analysts suggested. Those are three really big, bold calls. And, you know, as ever, you judge us on whether we're right. At this point, I'm done for the time being. And I hand over to Rowland, who is going to take you through Namibia on the back of the context. He's very welcome to disagree with my upbeat sense on the global economy. And then when he's done, I'm going to take you back to the rankings and talk you, with Rowland's help, through some of the scenarios. And thank you for listening to me now. And Rowland, it's all over to you.
Thanks a lot, Frans. So basically, I'm just plagiarizing some of the IRR or the CRA's work when it comes to this. But what we decided to do in order to make this relevant for this audience is basically to tweak some of their slides that would conventionally be South African slides and rather cover rather cover some Namibian key driving forces in this process. So I'm going to talk a little bit about those key driving forces here. And basically they break down along two specific lines. The first line is what kind of reserves do we have with which to deal with the economic impact of lockdowns and similar? And second, what kind of socioeconomic environment are we sitting in the country? And to what degree does that make it difficult for us to implement lockdowns and similar? So the driving forces that I'll talk about specifically, firstly, the social profile, secondly, isolation protocols in the country, thirdly, medical resources and testing infrastructure, markets and the economy, and then finally, the policy reaction in the country. When it comes to the social profile, basically what we think is of most importance here is the fact that there are two kind of key considerations when it comes to the vulnerabilities or potential vulnerabilities in the country. The first one is population age, and the second one is population density. When it comes to population age, basically we have a relatively favorable situation, I think, given the fact that the vast majorities of the COVID deaths that we've seen of late have been, or since the pandemic started, have been older population or older persons. When it comes to older persons, basically Namibia has an extremely young population, and this plays very much in our favor. The second consideration, however, is population density, and this is also something that we'll touch on in a minute. And then the final thing that was a major consideration early on was whether underlying conditions and immunocompromised persons are going to be vulnerable to this virus, and indeed whether as a result of the HIV/AIDS prevalence in the country, there wouldn't be higher fatality rates here than in many other parts of the world. But I think interestingly here, from this chart that you can see on your screen, basically under 10% of all of the deaths that we've witnessed are under the age of 54. I couldn't get the exact figure for under 60-year-olds, but we believe that that's about 14% of all deaths of people under the age of 60. If we go on to the social profile, as I mentioned, Namibia fares relatively well when it comes to the age of the population. The median age in Namibia is just 21. This is 5 years younger than is the case, than is the median age in our neighboring South Africa. So again, relatively favorable. We only have about 140,000 people in the country over the age of 60. And if we add to that the fact that we've got the second lowest population density in the world, we actually have relatively favorable demographics when it comes to the data that we now have on this virus with regards to the particularly vulnerable portions of the population. What's interesting, I think, to look at here is that the majority of the older population lives in the rural parts of the country, although there are, of course, older people that live in the urban portions of the country as well. But if you just look at this data, you can see how clear it is that we have this very, very young population and largely urbanized population as well. So this is an interesting consideration when we think about where we do have spots of population density. So while we have the second lowest population density in the world, there are still these areas where you have higher density. And that tends to be within the urban areas where you have a lot more younger people. Meanwhile, in the rural areas where most of the older people are, relatively lower levels of population density. And this plays well into a potential consideration around smart lockdowns, considering that where your vulnerable population lives, you do have relatively low population density, and also where your more vulnerable population tends to live, you have relatively less economic activity, and as a result of that, you can balance this playoff between economy and livelihoods relatively effectively if you're strategic about it. Another interesting consideration here is that in the urban areas where you do have older people, they do tend, although there are obviously exceptions to this, they do tend to be relatively more wealthy. And the implication of that is that it potentially means that those persons are more likely to be able to self-isolate. And if you do go through a process of ensuring strategic kind of lockdowns or strategic social distancing for vulnerable groups, that should not be as challenging in Namibia as it is in places like northern Italy and similar, where you've had these terrible outbreaks with high mortality. Continuing with the social profile, one of the offsets that we often heard when we made these points early on, when we were looking at the case prevalence and also the mortality rates across various different countries based on age and population density, the concern was that we have this large immunocompromised population. So roughly 10% of the Namibian population are people living with HIV. The vast majority of this group is on antiretrovirals. So 92% of all persons, HIV positive persons in the country, are thought to be on antiretrovirals. And the concern was that this may mean that we have a higher, even if we have the same number of cases as a percent of population, we may end up with a higher mortality rate because of this vulnerability that we have in the population. What's interesting to witness now is that the data really doesn't support that if you look at what's happened in South Africa. So we don't yet have the data for Namibia to give a good idea of whether that is indeed the case in Namibia or not. But if you look at South Africa, a very similar ratio of the population living with HIV, a lower percent of the population actually on antiretrovirals in South Africa, the HIV positive population on antiretrovirals in South Africa. But what we see in the statistics in South Africa is just under 2% of the known cases have resulted in death. The vast majority recovered. And this is obviously in a country that has been fairly behind when it comes to the rates of testing. So the likely incidence of cases is far, far greater than the known cases. And the implication of this being that the death rate is obviously not nearly as extreme as could be the case. And what appears to be the situation here is that the relatively youthful population in the region more than offsets any additional risk that may exist as a result of a relatively high HIV prevalence. The second consideration that we have beyond the social profile in the country or the demographics in the country is around isolation protocols and how efficiently and effectively isolation protocols can actually be implemented. So I think that despite the fact that we have a relatively low population density generally, there are areas of high density. And in the same way that we have a relatively low population, there are a relatively young population, there are old people as well. But these relatively high density areas, particularly in the informal settlements around the urban centers, they are potentially an area of risk of transmission. But the question is, does that result in a large number of deaths? So we have roughly a third of the population living in informal housing, roughly 40% of the urban population living in informal housing. And that does tend to be relatively dense conditions where you could have outbreaks of the virus that could spread quite widely. Our view is that there may actually be more risk of implementing lockdowns and forcing the younger, densely populated population to flee out of those urban areas back to the rural areas and take the virus with them to vulnerable groups in the rural areas than to have an outbreak in these urban areas. The reason that we say that is that with this predominantly young population living in the informal settlements around the urban centers, that group is not particularly vulnerable to succumbing to the virus, even if they may contract it because of that relatively young age. And therefore, we think that lockdowns may actually be counterproductive when it comes to protecting the vulnerable groups in the country if we're not very strategic about how we do those lockdowns. Another consideration around the isolation protocols is simply the fact that a large portion of the population is very vulnerable from a livelihood perspective during lockdowns. If we look at the percent of the population that we believe is not able to work from home, we estimate that it's around 60% of the population, the working population, that cannot ply their trade unless they are physically present at their work. Now, this is relatively common when it comes to developing economies where you still have a large portion of the population that's trading physical labor in exchange for an income. That's not true in places like Sweden and much of the developed world where you have a lot more people that are able to work from home who are not trading physical labor, often for the products or services that they provide. But in Namibia, we do have this large portion of the population that actually needs to be physically present at work in order to receive incomes. And while many employers carry the cost of people not being at work for a period of time, extended periods of lockdown or repeated lockdowns may make it impossible for those employers to do so. But I think that the situation that we see for much of the urban population is pretty impossible in many ways, meaning that either if we do have hard lockdowns where people are stopped from traveling to the rural areas where we do have these more vulnerable portions of the population, then you sit with this risk that people may be stuck in shacks that get up to sweltering temperatures during the day, and unable to work, unable to generate an income for themselves and feed families and similar, or they have to go to work, often in public transport, which is also a potential area for transmission. And this basically suggests to us that there is no real way that you can protect both livelihood and protect against the virus in these urban centers if you don't have large support from a state, for example, in terms of the stimulus packages, in terms of the grants and similar that the state provides in order to ensure people's livelihoods are maintained even if they're not able to go to work. Medical resources and infrastructure, I'll touch on very briefly. Basically, the majority of the infrastructure that we have when it comes to the medical side of things is concentrated around Windhoek. The relatively populous northern and rural areas, however, have very limited resources. And this is the area that we think may be most vulnerable, just given the fact that that's where a lot of your older population lives. The concern around this is that if we do have lockdowns that cause people to flee out of the urban areas to the rural areas, carrying the virus with them when they go, then you may actually have a much more deadly outbreak in the northern and rural areas where you don't have the medical resources to deal with it. So Namibia fares moderately well when it comes to the number of nurses and midwives per 1,000 people when compared to the other countries that you see on the right here on your chart. However, if you look at the number of doctors, we're amongst the lowest in the region and certainly amongst the lowest on all of the charts, all of the countries that you see in this chart. And this is a potential concern should we have a very material outbreak in a vulnerable population that needs to be hospitalized. If we just go on to ICU beds, there's a big distortion in terms of the number of ICU beds in private sector versus public sector. And most concerning, I think, is that most of these ICU beds are already used going into the crisis. So these are not free ICU beds available for COVID cases necessarily. But also 87% of the beds are in Windhoek, and I think a large percent of the remainder are at the coast. So this, once again, this area where you have potential vulnerability in the north of the country, where you've got older populations, that area is very, very underserved when it comes to availability of ICU beds. Nevertheless, we rank on a per capita basis very similar to many of the other countries in the region and around the world. So Spain, the US and Italy are around the same level as us, and we're slightly better off than South Africa when it comes to the number of beds, ICU beds per capita. So even though this looks like a very low number, it's really all relative. If we go to markets and the economy, I think that the starting point for this is really that we don't have a huge amount of data on Namibia just yet with regards to the impact of COVID on our economy. However, I think anecdotally we know quite a lot. If we look around the world, however, we can see that there's been this huge reversal when it comes to growth rates. So these red bars that you see on your screen now were the forecast real growth prior to COVID. And if you look at the latest bar, the orange bars, this is the latest forecast, which show that we've gone from much of the world expecting growth of between sort of 1% and 3% on average, to much of the world now expecting contractions of 4 to 5% and some quite a lot deeper. Now, what's interesting in our specific instance is that we go into this crisis from a particularly weak perspective where we've had nearly 5 years of basically no growth. And this puts us in a very vulnerable position when it comes to our ability to counteract the effects of both the virus itself and the external demand shock that we see with regards to tourism, diamonds, exports, and similar, but also with regards to the internal supply shocks and the internal demand shocks that come about as a result of some of the health protocols that we've discussed previously and will continue to discuss. So, but now we add on top of that an additional degree of complexity, which is the political pressure that we've seen building in the country over the last few years. And this political pressure largely stems from younger voters, many of them sort of born free or people born without any recollection of the pre-independence period. And we saw in our last election this material change in voter behavior or voter support. So this chart shows firstly GDP growth in the bars, And you can see from 2016 onwards, we've had no growth and contractions. And as a result of that, I think, at least in part, this huge reduction with regards to the support for the incumbent politicians, both SWAPO at National Assembly level, but also the SWAPO presidential candidate. And what's interesting to note with this is that in the 2014 elections, we saw this incredible increase in support for SWAPO, and that came after an extended period of growth. And subsequent to that, with the collapse in growth, we've now seen this collapse in support. And what that suggests to us is that we have a bit of a change in voter behavior generally, where your voters are rather looking at their livelihoods and economic performance, and whether their aspirations are being met by politicians, rather than the blind loyalty to the liberating party that I think went before. And this presents a very real challenge when it comes to how politicians deal with this specific crisis, because while we see this period of extended contractions from 2016 until now, the 2020 contraction is going to be substantially deeper than that. And while we may see some small recovery going into 2021 and beyond, the concern, of course, is that the real impact on people's lives and livelihoods may not be as positive as they would like, and that presents a very, very real challenge for our policymakers. Once again, this is driven by your younger voters, and these younger voters are also people that are not particularly vulnerable when it comes to succumbing to this virus, even though they may well contract it, and in all likelihood will. And we think that this speaks to this crisis of rising expectations of your aspirational young people that have been told that education is the routes to riches and so on, and don't really see it playing out that way, and are now looking for people to blame. So this presents a very, very complex challenge for our policymakers to deal with going forwards as well. The other consideration on the Namibian front that I think is probably something that is being looked at globally, but it is particularly prevalent in a country like Namibia, where we've run material budget deficits for an extended period of time, is the dry powder or the firepower that's available to us to fight off the economic headwinds that are presented by this virus, and to some degree the manner in which we deal with the virus. So the fact that we've had large budget deficits for 10 of the last 11 years, and that those budget deficits are now growing very rapidly as a result of COVID, mean that we simply don't have the reserves in order to offset the negative economic implications that we have as a result of this virus, and also to provide for people's livelihoods if we do have extended or repeated periods of lockdown. So our debt to GDP ratio has jumped in a single year from 50% to an estimated 70% this year. And we think that we are in we have a very material debt trap risk at the moment. And this really depends on whether we see a revenue recovery next year and the year thereafter, and what we're able to do on the expenditure side. Now, we tend to shock people quite a lot when it comes to this. We say that there's very little that you can do on the expenditure side without a material adjustment in the civil service wage bill. And the challenge around this is that the quantum of that adjustment in the civil service wage bill that would be required in order to get the budget even close to balance would be very extreme. So what we always tell people, a 10% reduction in the civil service wage bill would only free up about $3 billion, and yet we run a $22 billion deficit this year, likely to be a $20 billion deficit next year. If we then manage to do a 20% adjustment on that, that still frees up only a third, or it still reduces our deficit by only a third. And we would still sit with a very, very material deficit to fund. And the chance of a retrenchment or reductions in the wage bill of the quantum of 20%, given the political pressure that we see, given the very high levels of unemployment that we have in the country, is extremely low. The bottom line with all of this, however, is that there's very, very limited surplus debt capacity or surplus borrowing capacity, and very, very limited additional firepower with which to fight the economic and socioeconomic impacts of this virus. And this puts us in a very, very tricky position going forward, because either it strikes us often that either we have to fight the virus or we have to fight the livelihood implications, but we simply don't have the ability to do both to the degree that we would like to. These fiscal deficits are not per se a particularly abnormal thing at the moment. This is something that's happening around the world. But as Frans mentioned, we enter this crisis in a very different position to many other countries around the world, that have had fast-growing economies over the last few years, or at least growing economies over the last few years, and have also not run these extended periods of material fiscal deficits with relatively weak economic growth. The other consideration for us specifically is that our cost of funding are relatively high, and I think that there's an increasing concern around the country of the sovereign credit risk. And then that also links into the currency peg challenges that we could potentially face depending on how the whole situation plays out. The bottom line here is that we don't know exactly what's going to happen, but we do know that we have a relatively high degree of vulnerability at the moment. And the decisions that we make from a policy perspective are particularly important now, given this huge degree of uncertainty that we currently face with regards to this economic condition. While we don't yet have figures when it comes to the unemployment rates and what's happened with regards to unemployment post-COVID in Namibia, we know anecdotally that there's been a large number of retrenchments, and particularly retrenchments in the likes of the tourism industry, which is one of the single largest employers in the country. If we look around the world, however, there's quite extensive forecasts done by the IMF that show that the expectation around much of the world is that there will be a big increase in unemployment between 2019 and 2020. And if you look at South Africa, I think you can get an idea of what we could potentially expect in Namibia as well. That's say a 7-odd percentage point increase in the unemployment level. But what's interesting to note is that thereafter, around much of the world, the expectation is that that employment recovery will be relatively limited and relatively slow as well. So we'll see this upswing in unemployment this year, and most likely a small reduction from that higher base going into next year, but probably not coming back to the levels of unemployment that we saw pre-COVID. And this is a very real worry for Namibia, where you already have one of the highest and longest or highest sustained levels of unemployment in the world at 33% of the working age, willing and able to work population. And so this is potentially a big political risk going forward as well. When it comes to the policy reaction, we have been sort of thinking about this to quite a high degree following what's been going on in Walvis Bay. And what we think is probably at play here to a large degree is the fact that the population is quite aware of the kind of cost benefit when it comes to COVID and COVID lockdowns. The reason that we say this is that if you consider the cost of lockdowns in countries like Namibia, where a large portion of the population needs to be physically present at work in order to earn an income, and where also a large portion of the population doesn't really have much in the way of savings, but also where you have a government that is not really in a strong position to provide material stimulus and provide livelihoods for those persons that are not able to work. That cost is a very substantial and very large cost when compared to countries like much of the developed world, where you have a relatively small percent of the population that needs to be physically present at work, able to provide material support to those persons that do need to be physically present at work if they can't be. So from a cost perspective, Namibia has a very large cost to carry if we have these extended and repeated periods of lockdown. On the benefit side, however, the fact that we have a relatively young population, relatively well dispersed across the country, so relatively low population density, and it seems that HIV is not the vulnerability that we previously thought it was when it comes to COVID, then the benefits of these lockdowns is also substantially less when compared to countries like Italy, where you have an old and densely populated population. The implication of this is that both the costs and the benefits of lockdown swing against Namibia when it comes to treating the health challenges associated with this virus. And that's the complete opposite of many other more developed countries that are now trying to implement this. If we look at what's been happening at the coast in Namibia, what we see now is that the public has sort of started to become highly non-compliant after nearly 3 months of fairly extreme and very extreme lockdown. And the reason behind this is that we think that these hard lockdowns just present a very material threat to the livelihoods of the most vulnerable portions of our population. As well as that, and the livelihoods are more in the kind of short term, but in the longer term, we think that it presents a very material risk when it comes to employment levels in the country. And as a result of that, also a very material risk to long-term government revenue. And just because of the fact that government can't really step in and provide support where people's livelihoods have been negatively affected, it puts us in a position where many people are just no longer compliant with the lockdown. So the question going forward is really, how does government deal with this should there be another lockdown implemented, say cross-country or in specific areas of the country, and people are non-compliant? Many people understand this trade-off between their livelihoods and contracting the virus, and if left to make the choice for themselves, will say, well, the livelihood risk is actually a greater risk than the virus as far as I'm concerned. So will we see a material sort of infringement on individual rights and people being forced to stay home when they literally do not have the means to do so, do not have food to feed families and similar? Or are we going to see just a sort of ignoring of the lockdown rules and the police and military and similar that are supposed to implement them, turning a blind eye? And this is a very real question that we face going forward. I think I'll leave it at that point and allow Frans to take over again to take us through the next section.
Fantastic. I will do exactly that. I just need to reshare with you. There it is. Just get it up big screen. Let's get rid of presenter view. There we go. Right. Rowland took us through Namibia. I introduced the scenarios to you. I'll talk to them partly, and Rowland will talk to them partly. Now, as Rowland and I went along, you saw us ranking things, and now the reason for that can be revealed. On the impact ranking, we thought the policy reaction of governments will be the most influential thing determining the trajectory of the pandemic in any particular country or part of the world. Thereafter, the coming of a vaccine, because that, is a hard end to the whole saga. Seasons and temperatures, morbidity and fatality rates, and the other 6 or 7 factors listed beneath that. In terms of uncertainty, well, what are the things we felt we understood the least well? Morbidity and fatality data. We've got a sense that it's on the low end of the estimates. Quite how low, we don't know yet. And, the difference between 0.05 and 0.1 is very significant. Fiscal and monetary responses, would these hold up in the face of future geostrategic threats washing through the world or second infection peaks and curves? The patterns of infection, number 3, I think we've got a handle on that one now. Markets and the economy, of course, are secondary in terms of effect to whether the fiscal and monetary responses of governments hold up, and the related 6 or 7 factors beneath those. Now, when we build scenarios, we draw from the top end of the impact and the uncertainty rankings, the axes of the matrix around which the scenarios are built. In practice, in this case, we did it as follows. Go back to that slide. Policy reactions of government. We thought the driver of greatest impact on the evolution of the pandemic. That became the horizontal axis of the scenarios we developed 3 months ago. The greatest uncertainty we thought would be morbidity and fatality data, and that became the vertical axis of the scenarios that we developed. When you plot them across each other, you produce 4 quadrants, and each quadrant is a scenario, a potential scenario, of how the world or the country or the issue will unfold, given how the greatest uncertainty and the greatest factors of impact relate to each other over the weeks or months or years ahead. Stay with those quadrants. We just make them a bit more colorful this time. They're the quadrants, same axes, just make them a bit more colorful in order to draw out for you the various scenarios. And when we started this, again, remember this is 3 months back, but the model still holds today. We thought the best case for the world and for any country would be what we call the scenario of viral containment. What would happen here is that low morbidity and fatality data would soon become known and understood. That would make it acceptable for the leaders of the free world to back out of their lockdowns really quickly, open their economies again, maintain some degree of social distancing protocol for a period yet, economies would kind of get back into operation better than was feared. The health systems wouldn't be overwhelmed. The health effects, the death rates would be much lower than had been feared. The virus would have been well contained until either herd immunity or a vaccine came along. The global economy would hold up and we'd generally be okay. Now, applying this in practice, what do we mean? This chart sets out the sort of granular detail or more of it of each scenario. I'm going to do the first half, Rowland the second half. My half is this. If it is to be viral containment, then you want to see the following. Infection curves will be flattened after those first peaks. Treatment protocols will be really good and healthcare systems will keep up with demand. Mass testing and tracing capacity will be evident. The case fatality rates are going to be very, very low as 0.05%. Lockdown restrictions will be lifted as soon as that is understood. The distinctions between essential and other enterprises falls away. Economic recovery continues quite well, in fact, and social distancing and isolation of vulnerable communities continues until the herd immunity is developed or until a vaccine is available. The second parts of this graphic are for Rowland to talk you through. Rowland.
Thank you, Frans. So this is a scenario where the case fatality rates are relatively low, and that's relatively quickly recognized and responded to. So we think that that would be 18 months, sort of start to finish, into mid next year. We should be back to relative normality. We should have tourists returning to the country. We should be back at relatively full production. And ultimately, the end event here would most likely be improved data. So basically data showing that either global case fatality rates are relatively low, or specifically case fatality rates in our region with our relatively low average age of population would be relatively low. This, we think, politicians would get quite a big win from it, in the sense that by unleashing the economy relatively quickly, by returning people to work without incurring any additional economic damage, we think that that would be viewed very favorably locally and globally, and we would probably get quite a lot of good press for that. From an economic perspective, there's very little we can do about the economic damage that's taken place so far. Much of that is not our own doing, but just simple external demand shocks, so tourists not coming to the country, etc. But there's very little we could do about that. But by reopening relatively quickly, we could see this sort of relatively temporary dip in government revenue, and then as rapid economic recovery, government revenue recovery, etc., as is feasible or as is possible, given what's happened today. The best case scenario would be that this shock would trigger some kind of structural reform in Namibia. So in essence, I think what we've seen in the country over the last few years has been kind of slow grinding decline. But there's never been that material shock that's caused this sort of real wake up from policymakers to say, okay, we need to do something differently. We need to bring about some kind of material change in our economic environment. And COVID has the potential to do that. So we hit unemployment rates of 40-odd%. We have this major government revenue shock and a government debt shock. And coming out of that, we realize that we have to be quite dynamic when it comes to growing the economy again, attracting investment, creating jobs, etc. So that's the best case scenario. And back to you, Frans.
Yeah, and when we started this 3 months ago, we didn't know what was going to happen. I really didn't know. And if you push me now on the world, I think it's stacking up to be this one for much of the world. And that is very good news, although there will be some societies that are not going to follow the pattern. The second one suggested by the Matrix was a scenario we called viral mitigation. And this would happen where high-end death rates manifested. And then in the free world, democratic societies, it would be deemed appropriate for governments to persist with extended lockdowns, despite the economic harm that they inflicted. in order to save what lives they could as a consequence of lockdown. And then you'd mitigate the effects of the virus itself, but you'd suffer some considerable economic harm. In detail, what would happen in such a scenario is that the country would go through a series of dramatic infection peaks over 24 months, case fatality rate upward of 1%, healthcare infrastructure stretched, too little testing, national lockdown would be extended several times over amidst a mass death data. There'd be very limited exceptions, and regional and localized lockdowns would continue for a long time. A very long time. The time frame and the economics, I give back to Rowland.
Thanks. So in this scenario, we would basically have an extended period of shock in Namibia, and I think that would be in part due to the fact that we have so few cases today. So the whole idea of flattening the curve is that you extend the crisis out over time so as not to overwhelm your healthcare, your health services. The end result in this scenario would most likely be a vaccine, basically from the fact that it would be a much more deadly virus than previously thought, or at least as deadly as previously thought. But we believe that simply the measures that government would need to take in order to keep the virus under relative control and ensure that we don't have this huge number of deaths would cause quite a material deterioration and internal stability in the country. Basically, just because of the fact that government is put in this impossible position, deciding between, do we try to save people from death directly without being able to provide them with the economic and livelihood support that's required in order for them to remain alive and feed themselves. And so that impossible challenge would basically cause many members of the public to start to break lockdown rules, and in all likelihood, those members of the public would likely be dealt with quite harshly by the police and the military, as that would probably be the only way to enforce some kind of compliance if we do indeed have this very deadly virus. From an economic perspective, that would be quite devastating for the country. It would basically mean that we would have repeated periods of lockdown or extended periods of lockdown, and the implication of that would be a very large reduction in GDP. Now, once again, this basically goes back to the fact that much of our industry and much of the employment in the country are persons that need to be physically present at work in order to be able to ply their trade. And as a result of that, we believe that primary and secondary sector collapse would be fairly widespread. These are the sectors in which most of those persons that need to be physically present at work are employed. So those employees unable to work from home would ultimately become unemployed. There are very few businesses in the country that would be able to sustain employment for extended periods if there were repeated lockdowns or extended periods of lockdowns. And ultimately, this would result in a collapse in government revenue long term. It would not just be a temporary blip whereafter recovery, but rather would result in very long-term, deep economic damage. And at the end of the day, government revenue would be unlikely to recover, and ultimately we would probably see some kind of fiscal debt trap. As well as this, if you just consider the persons that are unable to work from home, that would most likely lose jobs, that would result in a dramatic increase in inequality. So your relatively low-income persons suffering further losses in income. So material increases in inequality and also material increases in poverty, and this then puts a very large question mark next to the long-term policy response that we would see as a result of this shock. Frans, I'll hand back to you there.
Right. Number 3 for us was the worst case, and that we call where high morbidity and fatality destructive, both economic and political policy responses. That would work something like this: an exponential increase in cases, a case fatality rate in excess of 2%, healthcare resources completely overwhelmed, treatment protocols fail. But in the face of that health catastrophe, governments would move to enforce very harsh 3 to 4 months lockdowns. Quite a short-lived scenario, this, because you'd quickly develop herd immunity and pass on from that. But very few exceptions would be tolerated. And the risk in this for us is that in contested societies, or societies that had elements of their politics that weren't liberal Democrats to the core, negative long-term civil rights and economic policy precedents could be set that would not be unwound for a very long time after the pandemic had passed. A very long time, in our sense, is decades. The time frame and the economics are Rowland.
Yeah, so from a time frame perspective, this would be relatively short-lived in the sense that the efforts to contain the virus would be largely failed. And so you would see the virus spreading relatively quickly, a huge peak with regards to deaths, the military and the police still trying to enforce some form of lockdown, but not being very successful in doing so. And I think that what you would likely see from the public here is very much what you see from the public at the coast at the moment, where there's this sort of complete ignoring of many of the lockdown protocols simply because of the fact that people's livelihoods are not being, or people are not able to sustain themselves at the moment. And as a result of that, then you would have the military and the police and so on trying to crack down. The concern in this scenario, I think, is that it would set up this sort of long-term political meltdown. And the question around this is really how the ruling party and the politicians more generally would deal with that, and whether they would, whether we would not see a big left swing in policy generally and a very, very autocratic kind of government approach to dealing with the implications of this virus and the sort of subsequent economic meltdown. This is the worst scenario when it comes to economic conditions as well. So we would see a kind of complete collapse when it comes to GDP. And I think that the last point on the bullets on the right there is actually the really interesting one. And that is to say, many parts of the world are, if this virus is actually very deadly, as was previously thought and perhaps still currently thought in some places, but if it is very deadly, how do politicians deal with that? And will there not be a much more autocratic response in countries that have that sort of potential leaning anyway, that could result in a long-term divestment from the country? If that long-term divestment takes place, then obviously we have this divestment across the board, all sectors suffering. Also government revenues likely to collapse long-term, not just a short-term downswing as has been forecast so far. Ultimately putting us in a debt trap. Unemployment spiking easily above 50%. I think already if you strip out subsistence agriculture, Namibia is close to the 50% level. And then obviously, as mentioned in the previous slide, inequality and poverty spiking just because of the persons who end up being most vulnerable to these lockdown measures, being persons that are not able to just fold their laptop up and go and work from home. And I think that at that point, I'll hand back to Frans.
The last one, the fourth, and there is no fifth, was what we call viral exacerbation. And this, the matrix forces scenarios aren't you. That's why the method works so well. The question here was, what would happen if it turned out that this virus wasn't as deadly as was initially feared? But some governments, despite that, persisted for a longer period than necessary with counterproductive policy reactions. That we called exacerbation. They would exacerbate what the impact of the pandemic on their societies were. Look, something like this. Low-end mortality data. Healthcare protocols are quite good. Testing patchy between countries, but mostly there. But despite that, you go back to my figures on the American flu season. You'd face in those countries, despite the absence of a health emergency, several months of counterproductive lockdowns haphazardly enforced. And those countries would suffer a great degree of unnecessary. To close off the scenario.
Thanks. So from a time frame perspective here, I think that, well, actually, maybe before we get to that, I think the most interesting thing at the moment that we see is that it's quite unlikely that we will be in the bottom half of this playboard now that we have relatively good data with regards to the morbidity and fatality rates globally, but also given what we know about the vulnerabilities and strengths in our specific populations and specific demographics. So I think it's worth spending a bit more time on the top scenarios than the bottom scenarios. So the question seems to be now more to do with what the policy response will be, rather than how dangerous or how deadly the virus is. And I think every single day we get more information with regards to the fact that the virus is probably less deadly than was initially thought. Now, when it comes to the policy response, I think when Namibia went into lockdown 3 months ago, we didn't know very much about the virus. But now, as more and more information becomes available with regards to these mortality rates from the virus, I think that one can certainly say we're at the top side of the board, and therefore, do we go left or right when it comes to our policy response? If we do end up pursuing counterproductive policy, i.e. repeated and extended periods of lockdown, harsh crackdowns and similar, then we would be in this top left side of this playboard. And that would basically mean that we would have sort of extended periods of lockdowns. And my view on this is that it would probably be because we are looking at the wrong indicator. And that indicator is the number of cases rather than how deadly those cases are. And I think that that's a very real risk in Namibia at the moment. At the moment, what we seem to be doing is saying, oh, there's 8 new cases, 9 new cases, etc. And yet we have 0 fatalities. The concern around this is that we may easily be looking at that indicator that actually doesn't tell you very much. It's like looking at the number of flu cases rather than the number of flu deaths, which is obviously something that we don't do. But if we do look at cases alone, and we say, every time there's 8 or 10 or whatever additional new cases, we implement harsh lockdowns and so on to try to prevent the spread of the disease when the spread of the virus is perhaps not the particular risk, then there is a high chance that we end up in this top left quadrant. I think the public is starting to become quite aware of this. This fact that most people that get the virus and most people that have been tested positive with the virus in Namibia, at least, are actually not even showing symptoms. But the public is starting to realize that there's this trade-off between the potential threat to lives of the virus and the potential, or the very real, less potential, I guess, threat to livelihoods. And I think that that's what we saw in our president's speech yesterday, where he spoke about livelihoods for the first time rather than just about lives. So in the event that we were to sort of continue aggressive lockdowns and so on for cases rather than for fatalities, then I think that it would go on for quite an extended period of time. The simple fact here is that the expectation globally is that about 40 to 70% of the world's population will contract this virus at some point. And at the moment in Namibia, with our 55 or 60 odd cases, we are a very, very long way away from 40% of the population having contracted. The implication of this is that it could go on, what we say here is that it could go on for 6 to 12 months. In all likelihood, it could be twice that, depending on how politicians respond. The public dissatisfaction, I think, is a very real risk. And ultimately, I think that would then become social unrest. And then again, the question would be, how do the police and how do the military deal with that social unrest that would likely follow? From an economic perspective, we would, in all likelihood, see Namibia's GDP growth then sort of collapse, and we wouldn't really see recovery despite much of the rest of the region and much of the rest of the globe starting to improve quite quickly, I think, as Frans showed in some earlier slides. Unemployment would likely increase once again, and particularly in those lower skilled sectors where people have to be present at work in order to be able to earn an income. And once again, that would result in this inequality upswing, and particularly lower income persons losing their jobs, while relatively high income people who are able to work from home not being as badly affected. Government revenue would remain weak and recover very slowly, and ultimately we expect that this scenario would still push us ever closer towards that fiscal debt trap and put us in a very difficult position to recover from long term. And Frans, back to you.
Thanks, Rowland. We don't think there's a fifth view, and South Africa, and in your case, Namibia. will be able to shoehorn into one of these four quadrants. My sense is that for the world, it's going to be top right. My sense for South Africa, regrettably, is it's going to be top left. And I think that that's also implicit in what Rowland said about Namibia. Our conclusions, as on the whole, is that mortality data and strategic responses will ultimately be judged to have determined the severity of the effects on any country, Namibia included. The evidence is now quite clear on, I think, certainly more than when we started, on what the mortality data is and what strategic responses work and which do not. We are upbeat on the world, more so than other analysts. I spoke to a bank last week, an international bank, and they called me afterwards and said, wow, you are upbeat. We are not as upbeat as you are. Namibia entered this crisis, however, like South Africa, in an already weakened state. And the twin deficits are such a useful measure of that. And therefore, there is the risk of decoupling. That Namibia, like South Africa, might have a different post-COVID crisis trajectory to the great bulk of global GDP. Dangers here are information. If you don't have good information on the virus, on its trajectory, on the data around the virus, if you allow fear-mongering in a society, the media has been very guilty of that on this virus and remains so. The risk of prompting overly firm, conservative, excessively conservative, we're right here, political responses are likely, and therefore it's very important to share some of the information we've shared with you as far as possible. However, the danger in a place like Namibia is that such a conservative approach, as Rowland has set out for you, pushes you towards a very difficult fiscal position, one that later puts the currency peg on the line and triggers a material deterioration in living standards amidst a crisis of expectation amongst youth and the political consequences that flow from that. And I'll add one line to that too, that little, I forget the name of the book. The chap asked his colleague, how did you go bankrupt? And the colleague says, well, that's easy. First slowly and then very fast. And political parties and governments lose control of countries in the same way. And Rowland showed this really good graphic of SWAPO's political standing. Strong over time, and then that worm starting to turn downwards. That is the first, that is the slowly. And if you want to see a very fast, there's nothing like a counterproductive reaction to the COVID pandemic to trigger exactly that. And with that said, I hand back to our chairperson for this morning. And all of us, Rowland, myself, and my colleagues who are on the call, will be happy to take your questions. Thank you for listening to what we've had to say this morning. And back to the sort of controller of this meeting.
Thanks very much, Frans. I will be facilitating the Q&A session. Thank you, Rowland, as well. I thought that it was very good to get both the CRA and Cirrus perspective here and to give this discussion a Namibian flavor. But ultimately, it is a global phenomenon. Whilst you were both speaking, there have been some questions raised in the chat. I see there are more questions coming in. I think we will address those first, but we also have the opportunity to take verbal questions. Is that possible, Rowland? But I think best to submit your questions in the chat. So
you can take verbal questions as well. Just unmute yourself and ask away. And while you do that, I can fill remind Frans that the book he was looking for is Hemingway's The Sun Also Rises.
Yes, I know. Brilliant. Thanks. Yeah.
And all right, well, Well, let me go through some of the questions here. So then the first question that we received was from Aino Mvula, and it's directed at both of you. And it's a question that we at the Center for Risk Analysis get quite often, which is, what is the likelihood or probability that you attach to each of these scenarios? And I think it's a very important question from Aino, because I mean, ultimately with this crisis, we're having to make decisions of very high consequence in an environment of limited information and high degrees of uncertainty. And we need to think probabilistically about these different outcomes. So Frans, maybe if you could respond to Aino's question there first, and then we can hand over to Rowland.
Look, it's a very difficult thing always why do we work in scenarios, not in forecasts? And we don't work in forecasts because the track record of the global forecasting industry is useless. They haven't called anything for hundreds of years with any great accuracy, and they tend to miss the biggest things as well. We get around that in scenarios in the sense that we create plausible futures, things that could occur, and a limited number of those, and those must contain within them all plausible events. And I think this set does exactly that. It's really only if you accept that, and you accept that you need to make proto strategy for all four, that you are in a robust strategic position. And once I've got a client that accepts that, then I'm happy to start speculating about probabilities and the like. Let me just go back. It's such a good question. Let me go back. We wrote a book in November. Well, we submitted the manuscript in November about the future of South Africa and the world. And we didn't say there was a virus coming in March. But we did create a set of scenarios, and we wrote in the book on South Africa, be very, very careful. If there is a great external global shock, the consequences would be to dip the country into economic data such as that we will hear tomorrow when our finance minister gives his emergency budget. And clients would not have been inclined to go with that. They would have thought, they wouldn't, but the scenario was there. And a firm that had prepared for that and knew what they would do if there was an external shock, when they saw this virus coming, they had proto strategy in place, they could implement, they could respond at once and know what they'd do, and they'd do very well. And partly for that reason, the group I work for has a small fund that it looks after, and we're up over the duration of the pandemic. Even in the middle of the pandemic, we were up. Even when markets were down on 22nd of March, they hit their low point in America, we were still up. So I really do mean it, that don't write off any scenario because you think I know what I'm doing and I'm going to tell you which one it's going to be. But I think it's pretty evident now that the mortality data is going to be low end. So you've got to be top left or top right of the matrix. And I think the evidence on reopening and just broad economic common sense in much of the world is overwhelming. So I put that top right. On South Africa, I'm afraid, we're not going to have a terrible health catastrophe in South Africa, but we're not going to have structural reform either. And so I put us top left. I'd say probabilities now, I'd say I'm very confident that I've got both calls right. But 3 months ago, I said to clients, I've got no idea which way it's going to go. Start developing proto strategy for. I hope that sort of covers the question, David.
Well, actually, there was a question, a subsequent question around structural reform, and I see Aino's giving a thumbs up there. So thanks, Aino. If you have any follow-up, please do ask us. But you touched on structural reform. So I think since you're on the subject, why don't you elaborate on why you think there's limited appetite for structural reform?
We've been very unpopular with our clients for 3 years because we've said there's not going to be structural reform. The client's been very cross with us and said, you can't say that. And it's simple. I mean, our analysis is deceptively simple. There can't be structural reform in South Africa because there aren't structural reformers in South Africa. the balance of power is just nowhere near. The poor finance minister is about the nearest thing to a reformer in South Africa. It's not a neat reformer either. It doesn't fit into the box neatly. He's broadly countermanded by the cabinet, doesn't enjoy much support from the president, and is kind of the sort of awkward uncle who's forced to announce the deficit tomorrow. Both business and government in South Africa turns almost 180 degrees. South Africa is not going to have structural reform, and we stick with that view now. And I sometimes put it to a client differently. You're in our small group, so we talk frankly, and I say to them, look, if I told you, yes, there will be reform, what all the other analysts told you, and you told me what reform and when and what is my evidence, I would have nothing to tell you. It just is not there. And I think, you know, we endured quite a difficult time for 3 years, but my interactions in recent weeks with firms suggests that they are, to their horror, starting to come around to our point of view.
Rowland, do you want to offer any comments on where you think Namibia might be heading, given the scenarios that we've presented today?
Yeah, sure. So I think it's great to listen to Frans, and I think everyone in Namibia is pretty sick of listening to me. So I'd rather, you know, he gets the bulk of the floor time here. But I think that maybe just the Namibian context when it comes to how we're handling the lockdowns, I think is probably, or how we're handling the virus, I think could potentially be argued to be quite a lot better than South Africa. And I think that the announcement that the president made yesterday, you know, while cases are kind of spiking, we are easing lockdowns. And I think that recognizes, and the fact that he mentioned livelihoods for the first time, I think that that's starting to show this recognition of the fact that there's a trade-off between, you know, people's livelihoods and in the long term, short and long term, and the health benefits that one could potentially be creating in the short term if you have these lockdowns. And so I think that we are, while I completely disagreed with the timing of the first lockdown, I believe we went into lockdown much too early. We didn't have many cases. We didn't have community transmission. But I think that at the time it could still have been sort of feasibly justified, given the fact that we didn't really know, you know, what the morbidity and fatality rates were like. We weren't testing very much, etc. Now I think that given that we have all of that data, easing these lockdowns, even though there is this sort of mini spike in cases, is definitely the right thing to be doing. And I think that the fact that we have almost done a sort of 180, as Frans just put it, on policy on an issue like this is actually very, very, is quite a relief in many ways, that we haven't sort of battened down the hatches on a previous policy stance. And I think that we could actually be looking at that top right quadrant. Now, the secret with the scenarios that Frans has not told you is that the quadrants are, and the way that you describe them is the kind of extremes, right? And you could be in that top right quadrant without going right to the extreme of that top right quadrant, meaning that you go through a sort of extreme structural reform. So you could still have a good short-term policy response without the brilliant long-term policy response. And I think that that's most likely where Namibia is going to go. And I think if you take this scenario and you make it the sort of center of your dartboard, as it were, but with further scenarios outside that with regards to the long-term direction that you take post-crisis, I suspect that in that outer dashboard, there's still a very high risk that we have counterproductive long-term economic policy, policy that doesn't encourage the investment return, the job creation, etc., that we need for long-term recovery post-COVID. And I think that that's still quite a high risk. But I think short-term, with the COVID-specific scenarios, I think that the most recent decisions, the announcement yesterday, is actually about as good as one could hope for.
Yeah, thanks, Rowland. I mean, I think that feeds into a question from, beg your pardon, from John Statler, where he offers a comment, which is my take following, I'm quoting John here, my take following yesterday's press conference is that Namibia could end up in the top right quadrant. France, your view is that probably both countries will be in the top left scenario. My question is, what if Namibia is poised for top right scenario, but France, if correct but France is correct with respect to SA? What will that mean for Namibia? Could we expect that Namibia will be pulled down with South Africa? Could it be an opportunity for Namibia to differentiate? And I think this is a topic that's come through in some of our other consultations in Namibia, is the extent to which, there's obviously the Rand peg, higher level of interdependency and trade. But also, I think some significant opportunities there, just if we're considering structural reform for Namibia to differentiate, as John alludes to. Frans, what are some of your impressions there about opportunities for Namibia?
Yeah, absolutely. I think the opportunity to differentiate has been around for a decade for Namibia. And I don't think it sees that opportunity. This just is the opportunity on steroids to differentiate. And I think Namibia would do extremely well. And I was asked once, I think it was in Namibia, I said, yeah, Namibia should become super competitive and steal a lot of South African investment that should flee across the border and set up shop in Namibia. And Namibia will become some Dubai of Africa. It would be wonderful. And then some chap said to me, but how can you say that? You come from South Africa. This would do great harm to South Africa. That's wrong. It would be the best thing that could ever happen to South Africa. The idea that South African skills, expertise, institutions of excellence were trekking to Namibia would inspire South African policymakers to greatness. They might at first fight. There was a wonderful moment a few years ago when I think the South African Trade Minister, quite a few years ago, spoke out in frustration at Lesotho stealing South Africa's clothing industry and factories. And that little Lesotho, with its share of GDP, was undermining South Africa's industrial strategy. Was just an irony lost on the man, I think. Probably still lost. So definitely the opportunity is there. It's so simple. It's so straightforward. Namibia is so well positioned. You know, the big, if you want to get the attention of it, it's a small place. You need to create 1 million jobs or something in that nature, and you have maximum employment. You don't have throngs of millions of people. I mean, South Africa's got to create 1 million net new jobs a year for a decade if it wants to reduce the black unemployment rate to the white rate, implying a growth rate of 10%. It's got real problems. Namibia does not have that. If you want to get the attention of Western diplomats, remind them, once you've explained where Namibia is, that when you stand on the coast and look that way, the next stop is New York. And that's very important. You're basically their neighbor, but for a boat ride. And build a couple of railways and things, become a major exit point for resources, commodities extracted out of the continent. Introduce a competitive tax code. You'll have, the potential is enormous. I mean, the frustrating thing about being in Namibia for me is that Namibians talk about, how could we mitigate poverty? Or how could we? That's not the discussion Namibia should be having. Namibia's discussion should be, how can we become a globally influential powerhouse in Africa? And what does it take for us to be there in 10 years' time? It's perfectly possible. But you've got to think on that scale. You can't think about how can we make poverty less. You've got to think, how do you become great? Great Namibia, best thing that could happen to South Africa. And I agree with the sentiment of the question.
I think maybe just to add to that, David, I think, Frans, you even underestimating the problem when it comes to that. The most common question that we're asked in after our presentations and things where we have these sort of longer term trends and when we're looking at where we're heading as a nation is, if you were in charge, what sectors would you pick to prioritize. And I think,
you don't want to pick sectors.
no,
Yeah.
that's exactly.
I know. No, I agree with you. I know where Rowland's going with this, and it's a terrible question. We get it in South Africa too. Sort of what sector should the government back?
Yeah.
And it's a ghastly question. Sorry, Rowland, I just had to say that.
Well, I'm glad that you respond with such a degree of exasperation as do I. The challenge around it, though, I think, is that, you know, we always tell people that if it comes to picking sectors, you're limited to the ability of the brains in the room. And if you create an environment that enables all the brains in the country and in the world to pick sectors that they themselves can invest in and generate a return and innovate in, you have a far, far wider array of options that could drive your growth going forwards. And I mean, just speaking to your point around the opportunities to take advantage of the situation in South Africa, through the depths of the Zuma years, we suggested that Namibia should sell itself as a sort of Mauritius on the continent and try to attract some investment out of South Africa to Namibia. And we, at the time, jokingly, but only partly jokingly, said that you had to do a roadshow to that famous richest square mile in Africa, and you would have some of the highest growth rates the country has ever seen, and you would be able to achieve the lowest levels of unemployment that the country had ever seen, just with one well-coordinated roadshow to 1 square mile in South Africa. And I think that remains true. We thought that opportunity may have slipped us by if indeed Ramaphosa had turned out to be the reformer that some people thought he may be. But I don't think that opportunity has slipped us by at all, and I think still exists for Namibia to become the Singapore of Africa, as it were. And indeed, that's something that we're working on in the scenario project with yourselves. The question, John, that I think is actually very interesting is a question around, you know, whether Namibia should start to sort of distance itself from South Africa. And I think that the answer is an absolutely unequivocal yes. The question, though, I think needs to be fleshed out to look at how that can be done. A simple decoupling of the currency and sort of trying to distance ourselves from South Africa from that perspective would not be particularly helpful. In fact, it would be quite detrimental to us. But I think that if we have an economic policy environment that differentiates ourselves, an investment policy environment that differentiates ourselves from South Africa, then we could quite easily get to a point where we voluntarily decouple from the rand, and where our currency is not a weak and volatile currency, but actually could be quite a desirable and relatively stable and strong currency on the continent. And I think that that's something that we should actually maybe put some work into, looking at how can Namibia constructively sort of decouple itself from the South African economy and ultimately probably work towards having an independent currency.
Rowland, I think you have answered inadvertently a question from Floris, who was asking what were the key reforms that you would like to see in Namibia and South Africa. But there was also an earlier question from Malcolm Husselman asking, how is Namibia and South Africa able to function with such sustainably high levels of unemployment? Will this crisis and subsequent spike in unemployment be a trigger for instability and violence? And I think certainly if you look at both jurisdictions, there are severe constraints on the labor markets in these countries. In South Africa, under the expanded definition, we have about 10 million people who are unemployed out of a total population of about 58 million people. So there are various social consequences to that. And you mentioned our scenarios project that we're working on together with you in Namibia. And that's certainly been one of the key focal questions, is how will we be able to turn Namibia's unemployment crisis around? Do you want to offer any comments there, Rowland, before I hand over to Frans?
Frans, I think, can go ahead. I think that the focal question that we had for that scenario project is how do we ensure that, 95% of all Namibians are in gainful employment by 2030? And it seemed like a bit of a crazy question, but I think if you consider all of the positives that flow from people being in gainful employment, with regards to socioeconomic development, I mean, pretty much covers everything, and the dependencies on government handouts and similar disappear altogether if the bulk of your population, or not altogether, but to a very large degree, if the bulk of your population is in gainful employment. And we picked 2030 as a target simply because that's the country's vision 2030. And while it seems crazy that within 10 years we could get to a target like that, we think that it is possible. And we think that in the next 10 years, the country will swing one direction or the other. Either we will have a very material deterioration in living standards as a result of a currency decoupling and government default and things like that, or we will have a very material swing pro growth, investment, job creation, etc., and could quite easily, or not easily, but could conceivably hit that target of 95% of the population being in gainful employment within 10 years.
Yeah.
Frans?
Yep, no, I mean, I don't think Rowland is unrealistic. Of Clem Sunter, who gave a lot of his time and investment into the scenario sort of outfit we've created here. And when I did my first set of scenarios, we're going to be a book. This was a few years ago. We drew them on the beach in Cape Town, on the sand with a stick. And they've also, quite. And I said to him, what are the prospects of this? And he said, listen, his experience is that your scenarios happen much faster than you realized when you wrote them. You get into them, better or worse, really, really quickly. And your mistake, he said, will always be to get the timing wrong. You're too late on the upside or the downside, partly because audiences such as this one here will find it incredulous to think that a society could change as quickly as societies do change. On the question of instability, I don't know Namibia well, but I know South Africa's instability patterns very well. And the relationship between growth, jobs, living standards, confidence in the future, ANC support, and levels of violent protest action are reliable. And we've tracked that over a long period of time. So we know what the consequences are. In the short to medium term, populists will try and exploit socio-economic reversals to their own ends, but remember, revolutions eat their children. And in the end, the revolution comes for you as well. And I don't think there's any reason to think that there's a society anywhere in the world that's immune to that. It's a question of time. Do not meet the expectations of your people by introducing counterproductive policies, and you've set the clock ticking on a political realignment. South Africa's one, I think, is going to be much sooner than people realize. Namibia, I don't know enough to venture an opinion, but I don't see any reason why these rules, they're rules of analysis, why these do not apply.
Yeah, and just to the earlier point, Frans, around the prospects for structural reform, I mean, we would see the labor market as really a weather vane for the appetite for reform. And something we try to impart to our clients is just the importance of the underlying ideological thrust of policy. Policy isn't just a technocratic exercise, it's also the expression of a prevailing idea within the government. And that prevailing idea in South Africa's labor market is the idea of decent work. So all of the legislative and regulatory consequences of that are seen in the Labor Relations Act, the Basic Conditions of Employment Act, the National Minimum Wage Act. But until that idea of decent work changes to favor low fee employment, which will see much greater numbers of people entering the labor market and being able to gain an income for themselves and their families, you're not going to see the policy really changing. So that's why the contestation around ideas is also so important.
Yeah, and this is really important because a lot of our clients are confused about the South African government. They say, look, they know unemployment, young people unemployment effective rate in South Africa, people under the age of 24, is 70%. So it's a very high number. And amongst those people, ANC does very badly in elections. And this is known. And our clients assume, because it's known and because it hurts the ANC, they will do something about it. And this is a dangerous assumption in politics. It's not about the ANC, it's about politicians broadly. Politicians all around the world lose elections and governments are removed and new governments replace them. This is what happens. And the reason it happens is because the government of the day does not act in the face of public pressure for reform. And one of the reasons they don't is that the government maintains late into the day the idea that its ideas will prevail. Now, the ANC has lost a lot of support in South Africa in recent years, and we chat a bit to the people who run the country. And I'll tell you, they're not surprised that they're losing support. It's not. They were not astonished at the election result. They're not flummoxed by the fact that the economy is not growing. And none of these things come. The only people sometimes you see astonished and flummoxed. And that's a really important.
Sorry, Frans, we just lost you for about 10 seconds there.
Yeah, sorry, you lost a bit. My experience, and this is a really important bit of getting any analysis right, is to understand that people who run governments and political parties will not always act in a logical or sensible manner. And that is why they lose. And therefore, when you start to see such patterns of behavior, and those patterns are prolonged for years, you must start to move towards the conclusion that the inflection point will be some form of political realignment. But the mistake, I think the core mistake investors make about South Africa is to assume that because it's obvious that policies harm growth and low growth harms living standards, which harms the ANC, reform will follow. That is a big leap, and it's a leap too far to make. Yeah, when people say why don't they change? One of the parts of the answer is ideology. They believe this is why the Soviet Union collapses. This is how any great transition, apartheid, South Africa persisted in the belief of separate development, despite the obvious evidence that it was a very, very bad idea and gone. And so, yeah, don't assume that because the evidence is obvious that policymakers will respond to the evidence as you would. The key to any good geostrategic analysis is to know what the subject of your analysis will do before they know what they will do. And if you get that right, then you'll live a life without surprises. And certainly what we at the CRA try and give our clients is a life without surprises, even if at times our clients get a bit cross with us and say, you guys are too upbeat, you're too downbeat. We're just reading into the embryonic trends. They're inevitable, long-term precedent of history, consequences. David, back to you.
Yeah, thanks, Frans. And we keep hearing about the so-called new normal and the new post-COVID-19 world, but it seems that the old ideas that preceded it, that there's a status quo bias there, particularly in terms of ideology and policy. But I think that is going to sooner or later run up against the hard reality of the economic conditions that we find ourselves in. Rowland, do you have anything further that you'd like to add, just in terms of Namibia's current context and its prospects?
Not really. I think one thing that's interesting I'm interested to hear that people sometimes tell Frans that he's too upbeat. I've yet to experience that one personally. But I think we experience the same thing here generally, which is, for a number of years we've been told, our analysis is quite negative and possibly too negative. And then a year later, when you go back to present at the next strategic session, you're told that your analysis was much too positive last year. And, where's that spark of positivity that, we sort of hoped to get from your presentation and didn't. So I think we see a lot of that. What's interesting for me from our perspective here is actually a longer term question around the kind of policy response to this particular shock. And I think if you think back to the slides, one thing that you may remember is that there's a lot of slides that talk about, when it comes to the scenarios, this upswing in inequality and poverty. Now, inequality has been a huge sort of focal point in Namibia, and I think perhaps understandably so, because of the high degrees of inequality that we have. I mean, inequality is a fact of life, but these high degrees of inequality are believed to destabilize societies, and especially if you can pin them to, sort of historical exclusion or something along those lines. So, so the question that we get asked a lot by, I suspect, most of the sort of people that are on this call is very different to the type of question that we get from the type of people that were on the call on Friday. And on this call, most people will say, oh, but it's obvious, when this crisis is over, government will have no reserves, households already have virtually no reserves, businesses will have no reserves, and therefore the only way that we're going to get the economy growing again is if we are pro-investment, pro-business, and we deregulate, we make it easier to do business in the country, etc. And therefore we should see this kind of positive policy swing towards a more investor-friendly kind of policy. And we think that that's very naive analysis. We think that if you consider this increase in inequality and poverty and so on that I mentioned previously, and if you consider who will walk away from this crisis most versus least harmed, the relative wealthy that can just fold their laptops up and go and work from home, can stock up on months of supplies of food and wine and similar, they will be fine. It's the relatively less skilled, less wealthy that will be most negatively impacted by the external demand shock, and also in many instances, the internal supply shock. And the focus that many policymakers have is very much on if the focus is on the likes of inequality, then inequality will have got a lot worse. And I think that could just as easily push us towards more sort of redistributive kind of policy rather than investment policy, pro-investment policy. And the fact that over the last few years we've been down this road of sort of focusing on redistributive policy shows a lack of understanding to start with of how finite the resources that could potentially be redistributed are, and also I think a naivety or a lack of knowledge in terms of how these policies have worked elsewhere when they've been tried. So to think that then that suddenly this crisis will have made people more aware of how small the pie to distribute is, and to think that it'll have suddenly made people aware of the record of history when it comes to the successes associated with redistributive policy, which is pretty much zero, that I think is very naive analysis. So our view is that there's a huge question mark that lies ahead of us longer term when it comes to the policy environment in the country, just simply because of where the pain, let's call it the distributional impact of the COVID pain. And I think that we could quite easily see quite a negative policy swing as a result of that as well.
Thanks, Rowland. Yeah, I think certainly you cannot redistribute your way to prosperity. You need to have growth as the underpinning of future prosperity. Yeah, and I think policy needs to reflect that. And as Thomas Sowell once said, there are no such thing as solutions, only trade-offs. And I think the magnitude of the trade-offs that are needing to be made at the moment are profound. And I think it's a very important insight from Thomas Sowell, because there's no such thing as having everything. You need to make those difficult choices. And if getting back to the labor market example, it's very difficult to have high-paying, secure, abundant jobs. You sometimes need to make a sacrifice on one area, such as wages or flexibility. All right. Well, I don't see any further questions in the chat, but if there are any follow-up questions on any of the points that have been made here, we'd also be happy to engage, through Rowland further with you. And the slides will also be made available after this call. And I see that a recording has also been made. So I think if anybody would like to refer back to that, I'd refer them to you, Rowland. Frans, are there any final concluding remarks from you?
No, I don't think we've not said something that's important. I can summarize very briefly for you. We remain at the CRA, so separate from Rowland, of course. Quite upbeat at this time in our outlook for the world. We think that South Africa is not going to follow that pattern, and that's probably in time going to trigger a political realignment in South Africa. That will be the reform inflection point. That could easily happen in the next decade, as early as 2024. If you enjoyed what you heard from us, stay in touch with us, stay in touch with Cirrus. The CRA chaps do a lot of interesting things, notes on Monday mornings about the world, and if you're interested in that, send us a mail and we'll be in touch with you. And I hope that we will retain what has become over the years, occasional presence on the sort of Namibian briefing circuit. It's something we enjoy, and I think your potential is extraordinary. And it's a bit like going, if you go to Israel, you realize that South Africa doesn't have problems and that it could solve its problems overnight, be really successful. And when you go to South Africa, you realize Namibia could solve its problems overnight. And strength to you all, where a couple of sensible policy decisions will set you on a fantastic trajectory. Thanks to David for this morning. Thanks to Rowland and his colleagues. Thank you to you all for attending. And I hope to talk to you still a few times before the year is out.
Thank you very much, Frans, and thanks also from my side. Rowland, is there anything that you would like to add by way of conclusion?
No, just thanks to everyone for taking the time out of the morning to join us, and we'll certainly be in touch with everyone at various different points over the next few months. Cheers.
Excellent. Thank you very much.